It's time now for Ask the Surgeon, brought to you by Everett Bone and Joint. Everett Bone and Joint, the best choice to get you back in the game. Learn more at everettboneandjoint.com.
All right, welcome back to Health Matters. It's the Ask the Surgeon segment. Our good friend, Dr. Clay Wertheimer, orthopedic physician from Everett Bone and Joint, is with us to talk about shin splints. How are you?
Good. How are you, Maury?
Good, thanks.
Clay, how you doing?
Good, Shannon.
Excellent. Hey,
guys?
We're doing great. Here's the deal. We got people out starting to run, get active, pounding around on the pavement and trails and stuff. Tell us what shin splints are, or medial tibial stress syndrome.
Yeah, medial tibial stress syndrome. Well, first we'll get our anatomy straight. It's not the chin below your mouth. It's the shin below your knee.
There you go. Yeah, there you go.
Yeah. So your leg, and typically it hurts along the inner part of your leg, just above your ankle, below your knee.
Okay.
And it's typically this medial tibial stress syndrome is due to overuse. So it's a training error. People are going out there and pounding their legs too far, too fast, too much. And we think that the muscles on the inner part of the leg, or the inner part of the tibia, the soleus muscle, and the muscles that flex your toes, they live along that inner medial part of the tibia. They get overstressed, and their attachment to the bone gets pulled on, and that's kind of a special attachment where the muscle kind of sticks along the bone there, and that gets all irritated and inflamed. So that's the typical cause of shin splints.
So just to kind of set it up for those people out there listening, your tibia is your big bone in your lower leg.
Right.
The fibula is the smaller bone on the outside. Mm-hmm. So if you were to poke or press, is there anywhere these folks could touch? Or
yeah, if they just beginning from just above their ankle on the inside, on the side opposite from the fibula, and work their way up the back of that bone, that tibia bone, it'll hurt all along there. Typically from the end of the bone near the ankle, about 2/3 up, and that's where those muscles live and attach themselves to the bone. And with repeated pounding, especially, those muscles get tugged on and pulled on because they resist, and they act as shock absorbers for the leg, and we think that they in turn get damaged a little bit and inflamed.
Is this something you see just with runners, or can you get it playing basketball or football or baseball?
We see it mostly with runners and joggers, people that have suddenly changed their mileage or started training for a half marathon and bump up the amount of pounding. But yeah, in court sports as well, you can see it, basketball players as well. There are a couple of other things that can cause this kind of pain that people should be aware of, and they're not as common, but they can be very serious. One is a stress fracture. A shin splint is different than a stress fracture. A shin splint is where the muscle and bone junction, or place where the muscle lives on the bone, gets irritated.
So that connective part where the muscle connects to the bone is inflamed with a shin splint.
Right. And with a stress fracture, that's all bone. And what happens is a similar kind of thing. It's an overuse injury, too. The bone sees more load than it's capable of withstanding, and it begins to crack and fail, first on a microscopic level, and then later it can be as serious as a real crack or fracture that you can actually see on an X-ray.
So how would someone differentiate between those two, the shin splint overuse or the bone stress? What are the signs and symptoms of that?
Yeah, well, signs, like we were saying before, you can kind of feel this diffuse area of soreness is more characteristic of the shin splint problem, where if you have a focal area, one hot spot on your bone, on your shin, on your tibia, that's more consistent with a stress fracture.
So like with a shin splint problem would probably increase pain-wise with activity?
Yes.
And then when you rest it, that pain should subside. Yeah. Now, but a bone fracture, tell us about that pain pattern.
That stress fracture will typically hurt even at rest, and can hurt at nighttime or wake up.
Yeah, I was just going to ask. A lot of times I know you, as an orthopedic, when you're doing a history, you always ask about night pain.
Right.
Is that trying to rule out a fracture type?
That's one of the reasons that things that are really serious, like fractures or tumors, can hurt at night.
Okay.
And shin splints, as you pointed out, typically hurt when you're using your shin, but when you rest it, it gets better.
Okay. Go ahead.
Can I ask a question now?
Have you ever had this problem, by the way?
You know, I don't think I have because I wasn't a very big runner.
Okay.
That's why. But my question is, if I get shin splints running and then at night, there's no pain, does that mean I can be running again the next day, or is that something you have to shut her down for like a week?
It usually longer than a week, where you need to shut her down for several weeks to let your body heal and rest and recover.
So when you're doing that, you ice it?
Ice it, rest it, stretch the muscles. Sometimes going to Shannon's place can help, particularly for a high-demand athlete, someone that we want to accelerate their recovery. We'll often send them to physical therapy. And there are some underlying conditions that can make people more prone to these shin splint problems. We think that people that pronate their feet, that turn their feet in when their foot hits the ground during their walking or running phase,
these would be
prone.
the people with significant flat feet.
Yeah, flat feet, or even functionally, they may not have flat feet when you look at them, but when they're running, their foot really pronates in. So those are the people that tend, if you look at the back of their running shoe,
right,
it's really worn out on the inside.
So inside that instep of your shoe, if you're wearing that flat or...
So they need orthotics then?
Orthotics can really help and help prevent the shin splints from happening, and if you catch the shin splints early, keep them from getting worse. But rest is a really important thing. Rest and stretching, keeping those muscles, strong and not fatiguing out, we think helps a lot.
But if you're a runner, and you can always go to some kind of cross-training method, like it's just stay off of hard surfaces, pounding.
So like biking
or
cycling,
swimming, getting in the water, working
or even running in the water is a good rehab for some of these people that are really focused, on running. They're training for a marathon or something like that, to keep their cardio up and their muscle strength up.
Yeah, and a lot of people in our practice, we've seen people come in that are training for a marathon or half, and that's a real goal. It's a real personal goal, and all of a sudden they develop these shin splints, and it's hard to convince them. You have to stop that activity and let that muscle rest, or that connective tissue rest, heal up. So cross-training is the way. What about, is there anything surgically? Do you ever see any problem? Have you ever had to repair this or go in and clean it up? Or?
No, surgery really, there's not really a role for the shin splint problem. It will heal given the appropriate non-surgical treatment, rest, rehabilitation, correction of that pronation problem.
Would you ever put someone in like one of those immobilizers, those boots, just to kind of stop and immobilize the whole, if it was real bad shin splint problem?
I would consider it if it was real bad and the patient was, one of those people that just needed that to immobilize them.
And the next step would be tie them down.
Yeah, exactly, yeah.
Just a comment in terms of the stress fracture issue. There's kind of a subpopulation that get stress fractures of their tibia that are important to be aware of, and that's young women who exercise, particularly runners and long-distance runners. And they can sometimes have this kind of terrible triad of they miss their menstrual periods, their estrogen levels are low, they're not eating very well, they think that they need to be really light, and they don't, their nutrition is not great, and then they overuse, and they're running like crazy. Those are the people that may present acting like a shin splint, but really they are stress fracture patients, and they need to be evaluated and treated, and that's a whole different thing than just a shin splint.
So when should a person seek medical attention then? Is this, what are the key factors there?
I think the key factors, certainly as we discussed, is if you're getting pain at rest,
or at night maybe?
Or at night, you need to be checked out to make sure it's not a stress fracture or something rare that could give you, could be a serious cause of pain in your bone. And then if rest, stretching, icing down, making sure that you've corrected your pronation and looking critically at your training hasn't corrected the problem, then seeing a specialist or someone that deals with this problem would be important, because as I mentioned, there are some other things that it can be other than shin splints, and sometimes it can be hard to distinguish between the other things that can cause a similar pain.
One of the things that we've often looked at and tried to rule out in the therapy end of it is this compartment syndrome.
Right. Yeah.
And you want to talk about that a little bit? People can actually develop pressure gradients in their calf muscles.
That's right. Yeah.
And so describe that a little bit.
Yeah.
Pressure gradients.
Well, I was gonna let Clay. He's Bill Nye, the science guy. I was gonna let him take that. So, describe that pressure gradient that Maury's
it's like
asking.
when you get a really hard question on the radio program, that pressure gradient.
Let's call Clay.
It helps, yeah.
The shin, the tibia, is real special. The muscles around it are in really tight compartments. So there's not a lot of room for those muscles to expand without the pressure in those compartments increasing. And in some people, we think, are born with super tight compartments more than others, and they're more prone that when they exercise and the blood flows to their muscles, the muscles get bigger and get engorged, they get squeezed bad, and so bad that they'll get pain because the pressure increases so much that the capillaries, the little blood vessels that bring oxygen to the muscles, shut down. And so then the muscle starves for oxygen, and both the muscle and the nerves in that compartment begin to complain. And if it goes on for a long period of time, those tissues can even be damaged.
So what are the symptoms then if someone has that?
Well, it's
going
really
on?
similar to Shin Splints, right?
Okay.
They get pain in their leg. Oftentimes they'll describe not only pain but numbness and tingling because it's the nerves also in the
so that pressure in that compartment kind of causes pressure on those nerves, and they respond with numbness and tingling.
Right.
Okay.
And they'll often
I told you he could handle the question.
Yeah.
He's got this down, doesn't he?
They'll often, the patients will often describe, and it'll be true, like their leg gets really, really rock hard in those compartments because they swell and get tight. So they'll have a characteristic, feeling like, wow, my leg just feels like a rock. So pain, that feeling of tightness, and sometimes numbness and tingling can come along with this compartment syndrome. It's a much more rare thing than shin splints. Shin splints are pretty common, and like you said, Shannon, earlier, this time of year where everyone's getting on their jogging shoes, the weather's getting nicer, and they get inspired to run that 10K or the Yankee Doodle Dash on the 4th of July downtown. And it's basically an overuse thing, and if it's caught early and one rests, ice, stretches, and gets into their activity level a little more reasonably, you can take care of it.
Well, I think that's the key. You just said it is catch it early. Don't continue to overtrain on it. I mean, modify your activity, rest it, ice it. Now, on this compartment syndrome, have you seen in your practice? You've been doing this a little while. Have you ever seen that?
Yeah, I have actually.
How do you diagnose that besides listening to 1380? I mean,
that's a good question. I mean, the one established way to diagnose it is to actually measure the compartment in the muscle. But that's invasive. We have to put a needle in there. The needle's connected to a pressure transducer, something that measures the pressure. And then there are certain criteria. If the pressure is above a certain level, or if after exercise the pressure stays above 50 millimeters of mercury, for, I can't remember what it is off the top of my head, but something like, 15, 30 minutes, then that is a established criteria. But mostly it's a clinical diagnosis, and you can make it by ruling out those other things, make sure the patient doesn't have a stress fracture or shin splints, and their blood supply is normal. I actually had an interesting case this year where I had operated on this young man's mom 10 years ago because she had dynamic compartment syndrome. And then her college-aged son, she brought her college-aged son in 10 years later because he was complaining he couldn't be a firefighter because climbing up hills and fighting fires, or when he went jogging, he'd get this excruciating pain in his legs, just like his mom did 10 years ago. And so released his compartments, and he's
fine,
able to fight fires.
Just kind of obviously maybe a genetic component there. Again, just talking about people with just tight compartments.
Exactly.
Yeah, interesting. Do you have any kind of recommendation for your patients that have shin splints, or how often they should change their running shoes? There's talk about changing shoes and shoe wear, and do you let other people handle that? Do you have any kind of recommendation?
Well, I mean, it depends so much on the athlete or the runner in terms of what their goals are and how many miles they're running. I mean, the general rule of thumb is if you're a recreational runner like I am, where you go out maybe once a week and jog, probably every 6 months it's a good idea to change your shoes and make sure that your shoes are in good condition. For the more elite athletes, I think it gets more complicated. I would certainly evaluate those people and see if I couldn't eyeball them and see that they were a hyperpronator. I might even consider sending them to some place that has an ability to do a videotape, high-speed video, and
do some gait analysis, running mechanics. Yeah.
So it really depends on the patient.
How about preventing shin splints? So let's say that Joe athlete decides, you know what, I think I'm going to start running. How do you prevent shin splints?
Well, I think a good thing is to either look up online. There's so many resources now, or in magazines, Runner's World. And if you have a goal, you're going to run a half marathon, then train for what your goal is and start that training early and follow some, good established guidelines for your training and how many miles you're going to run each week and how you're going to ramp yourself up to reach your goal. So start training early, give yourself plenty of time, and either find somebody who is experienced or a resource online or in print that can kind of give you some guidelines as the appropriate training.
For example, like maybe run every other day. I mean, the day that you don't run, maybe you bike or you swim, cross-train is always good. Again, like you said earlier, once you start having those symptoms, really be aware of those symptoms and modify your activity because you just don't want to keep irritating that, particularly if it's a shin splint.
A little problem can turn into a big one.
Yeah. Right. One of the other things, too, is, surfaces. You should run on a surface that kind of accommodates some... not a hard surface. Maybe get on a
point on a track or
those rubberized tracks now are really nice. So.
And stretch,
ice. Yeah.
Dr. Clay Wertheimer, as always, core. That's always been great stuff. Thank